Hi, today we will discuss in detail, what is breast cancer, types of breast cancer, risk factors that contribute to breast cancer, its prevention, signs, symptoms, diagnosis, and treatment of breast cancer. Before we go into those topics, please subscribe my channel and press the bell icon to get notified for my latest videos. What is breast cancer? Cancer is the abnormal, uncontrollable, continuous replication of cells which will inevitably lead to the formation of a tumor. Forms in the tissues of the breast, spread mainly through the lymphatic system. This is normal breast. Anatomy of the female breast. The lymphatic system. Lymphatic system, which consists of vessels and organs, plays two vital roles in our lives. 1. The vessels essentially maintain interstitial fluid levels by carrying excess fluids as well as any plasma proteins, back into the CVS. 2. The organs house critical immune cells such as lymphocytes, which carry out our body defense against infection. Most of the lymph vessels of the breast drain into lymph nodes under the arm, auxiliary nodes. Lymph nodes around the collarbone, supraclavicular and infraclavicular lymph nodes inside the chest near the breastbone, internal mammary lymph nodes. This is the lymphatic system, in which you can clearly see supraclavicular lymph nodes, infraclavicular lymph nodes, axillary lymph nodes, internal mammary lymph nodes. Breast tumors. Malignant, which is cancerous. Benign, which is not cancerous. Not cancerous benign tumors. Benign breast tumors are abnormal growths, but they do not spread outside of the breast and they are not life-threatening. Most lumps are caused by the combination of cysts and fibrosis. Cysts are fluid-filled sacs. Fibrosis is the formation of scar-like tissue. These changes can cause breast swelling and pain. This is common benign causes of breast lumps. Fibroadenoma. Cystic breast changes. Breast cancer is a malignant, cancerous, tumor that starts in the cells of the breast. It is found mostly in women, but men can get breast cancer too. Invasive and non-invasive breast cancer. Invasive breast cancer is cancerous, malignant, spreads to other organs, metastasis. Non-invasive is precancerous, still in its original position. Eventually develops into invasive breast cancer. The inner lining of milk ducts. Ductal carcinoma. The lobules milk-producing glands. Lobular carcinoma. Ductal carcinoma. Inflammatory breast cancer, IBC. And lobular carcinoma. Ductal carcinoma consists invasive ductal carcinoma. Ductal carcinoma in situ, CIS. While lobular carcinoma consists invasive lobular carcinoma. Lobular carcinoma in situ, LCIS. Inflammatory breast cancer, IBC, uncommon, 1% to 3% of all breast cancers. Invasive breast cancer. No lump or tumor. Mistaken for infection in its early stages. IBC makes the skin of the breast look red and feel warm. It also may make the skin look thick and pitted and may have an orange peel feel. The breast may get bigger, hard, tender, or itchy. Ductal carcinoma in situ non-invasive contained within the milk ducts. May become invasive, precancer. Invasive, or infiltrating, ductal carcinoma, IDC, most common breast cancer. Accounts for about 8 out of 10 invasive breast cancers. Lining of the ducts. Grows/invades the breast tissues. Spreads to lymph nodes. Other organs. Lobular carcinoma in situ non-invasive. Contained in the lobules and does not spread to the tissues of the breast. May become malignant. Invasive, infiltrating, lobular carcinoma, ILC, about 1 in 10 invasive breast cancers are ILC. Formed in the lobules. Grows through the wall of the lobules. Spreads. Factors that contribute to breast cancer. Risk factors increases your chances of having breast cancer but does not causes it. Breast cancer results from the abnormal, uncontrollable replication of cells of the breast. Risk factors are modifiable factors, uncontrollable factors. Factors that contributes to breast cancer are gender, age, genetic risk factors, family history, personal history of breast cancer. Race, ethnic background, dense breast tissue, certain benign, not cancer, breast problems, menstrual periods, breast radiation early in life. Gender, more prevalent in women. 1 in every 150 cases, male. Age, the chance of getting breast cancer goes up as a woman gets older. Over 80% of all female breast cancers occur among women aged 50 plus years. Genetic risk factor. Women who carry the BRCA1 and BRCA2 genes have a considerably higher risk of developing breast cancer. Family history. Breast cancer risk is higher among women whose close blood relatives have this disease. Personal history of breast cancer. A woman with cancer in one breast has a greater chance of getting a new cancer in the other breast or in another part of the same. Race, ethnic background. Overall, white women are slightly more likely to get breast cancer than African American women. African American women, though, are more likely to die of breast cancer. Asian, Hispanic, and Native American women have a lower risk of getting and dying from breast cancer. Dense breast tissue. Dense breast tissue means there is more gland tissue and less fatty tissue. Certain benign, not cancer, breast problems. Women who have certain benign breast changes may have an increased risk of breast cancer. Menstrual period. Women who began having periods early, before age 12, or who went through the change of life, menopause, after the age of 55 have a slightly increased risk of breast cancer. Breast radiation early in life. Women who have had radiation treatment to the chest area as a child or young adult have a greatly increased risk of breast cancer. Not having children or having them later in life. Certain kinds of birth control. Using hormone therapy after menopause. Not breastfeeding. Alcohol. Being overweight or obese. Tobacco smoke. Smoking may increase the risk of breast cancer. Night work. A few studies have suggested that women who work at night have a higher risk of breast cancer. Antiperspirant. Bras. Induced abortion. Breast implants. Non-modifiable risk factors. And modifiable risk factors. Non-modifiable risk factor include, gender, age, personal breast cancer, history, family history, proliferative breast conditions, breast density, early menstruation, late menopause. Modifiable risk factor includes radiation exposure, reproduction, breastfeeding, hormone replacement therapy, oral contraceptives, body weight, physical activity, alcohol use, tobacco smoke. Prevention, alcohol consumption, physical exercise, diet, postmenopausal hormone therapy, body weight, breast cancer screening, breastfeeding. Signs and symptoms. A lump in the breast. A pain in the armpits or breast that does not seem to be related to the woman's menstrual period. Pitting or redness of the skin of the breast, like the skin of an orange. A rash around, or on, one of the nipples. A swelling, lump, in one of the armpits. An area of thickened tissue in a breast. One of the nipples has a discharge, sometimes it may contain blood. The nipple changes in appearance, it may become sunken or inverted. The size or the shape of the breast changes. The nipple skin or breast skin may have started to peel, scale or flake. Signs of breast cancer. Lump. Skin dimpling. Change in skin color or texture. Change in how the nipple looks like pulling in of the nipple. Clear or bloody fluid that leaks out of the nipple. Pain. redness, scaliness, itching, skin thickening, inward nipple, discharge. Symptoms and signs. A change in size or shape. Redness or a rash on the skin and or around the nipple. Discharge, liquid, from one or both of your nipples. A swelling in your armpit or around your collarbone. A lump or thickening that feels different from the rest of the breast tissue. A change in skin texture such as puckering or dimpling, like orange skin. If your nipple becomes inverted, pulled in, or change its positions or shape. Constant pain in your breast or your armpit. Diagnosis. Diagnostic tests and procedures for breast cancer include, breast exam, mammograms, breast ultrasound, breast MRI scan, biopsy. Breast exams include, clinical breast exam, CBE, breast self-exam, BSE. Women in their 20s and 30s should have a clinical breast exam every 3 years. After age 40, women should have a breast exam every year. Breast self-exam, BSE is an option for women starting in their 20s. Any changes detected should be reported to a medical expert. BSE, conducted standing or reclining. With fingertips close together, gently probe each breast in one of these 3 patterns. Breast imaging techniques. Mammograms. An X-ray of the breast. It uses a very small amount of radiation. Mammograms include screening and diagnosis. A technologist will position your breast for the test. The breast is pressed between 2 plates to flatten and spread the tissue. The pressure lasts only a few seconds while the picture is taken. The breast and plates are repositioned and then another picture is taken. The whole process takes about 20 minutes. Normal mammogram. Benign cyst, not cancer. Cancer. Breast ultrasound. Uses sound waves to outline a part of the body. The sound wave echoes are picked up by a computer to create a picture on a computer screen. Used to investigate areas of concerns found by a mammogram. MRI. Use magnets and radio waves. Cross-sectional images of the body. MRI scans can take a long time. Used if view areas of concern found on a mammogram. Patients must lie inside a narrow tube, face down on a special platform. The platform has openings for each breast that allow the image to be taken without pressing on the breast. Contrast material may be injected into a vein to help the MRI show more details. Biopsy. A biopsy is done when other tests showed that you might have breast cancer. It confirms if a mass is cancerous or not. Mass is removed and studied. Types of breast biopsy. Fine needle aspiration, FNA, biopsy. Core needle biopsy. Vacuum-assisted biopsies. Surgical, open, biopsy. Lymph node biopsy. In FNA biopsy, very fine needle is used. Extracts fluid from the lump. Guided by ultrasound. Simple but is not 100% accurate. Core needle biopsy. Needle is larger than in fine needle biopsy. Removes more tissues. Clearer results. Done with systems such as TEC, automated tissue excision and collection. Guided by MRI. First the skin is numbed and a small cut, incision, is made. A hollow probe is put through the cut into the breast tissue. A piece of tissue is sucked out. Surgical, open, biopsy. Anesthesia is administered. Incision is made. Part or whole lump is extracted and studies. Lymph node biopsy. Removal of fluids. Needle biopsy. Removal of lymph nodes. Surgical biopsy. Examination of breast tissues. Tissues obtained during biopsy are examined to determine, malignant or benign. Type. Invasive or non-invasive. Size. Has it metastasized? Is the lymph nodes affected? Treatment. Factors considered during an examination. Breast cancer grade. Hormone receptor status. HER2/NOI status. Breast cancer grade. If a biopsy sample is cancer, it is given a grade from 1 to 3. A lower grade number means a slower growing cancer, while a higher number means a faster growing cancer. The grade helps predict the outcome. Hormone receptor status. Hormone receptors are proteins in cells that can attach to hormones. Estrogen and progesterone are hormones that fuel breast cancer growth. Breast cancers are tested for hormone receptors. If the tumor has them, it is often called ER positive, PR positive. About 2 out of 3 breast cancers have at least one of these receptors. HER2/NOI status. About 1 out of 5 breast cancers have too much of a protein called HER2/NOI. Tumors with increased levels of HER2/NOI are called HER2 positive. These cancers tend to grow and spread faster than other breast cancers. Test to find whether the cancer has spread. Chest X-ray, the lungs. Bone scan, the bones. Cord scan, computed tomography, the chest and/or abdomen. MRI, brain and spinal cord. Ultrasound, other parts. Staging of breast cancer. The TNM staging system. This system takes into account the tumor size and spread, T, whether the cancer has spread to lymph nodes, N, and whether it has spread to distant organs, M, for metastasis. Stage 0, Stage 1, Stage 2, Stage 3, Stage 4. Stage 0, non-invasive breast cancer. Has not spread to breast tissues. Stage 1, 2 cm and has not spread to lymph nodes. Stage 2. Stage 2A, 2 cm and has spread to lymph nodes, or 2 to 5 cm and has spread to lymph nodes. Stage 2B, 2 to 5 cm and has spread to lymph nodes, or greater than 5 cm and has not spread to lymph nodes. Stage 3. Stage 3A, 5 cm and spread to lymph nodes forming clumps, or greater than 5 cm and spread to lymph nodes without forming clumps. Stage 3B, any size and spread to the skin or chest wall. Swelling. Stage 3C, any size, spread to lymph nodes, skin and chest wall. Stage 4, metastasized. Survival rates. 5-year relative survival rate. 100% at stage 0. 100% at stage 1. 93% at stage 2. 72% at stage 3. 22% at stage 4. Treatment. The treatment of breast cancers will depend on various factors. The type of breast cancer, the stage and grade of the breast cancer, how large the tumor is, whether or not it has spread, and if so how far, whether or not the cancer cells are sensitive to hormones, the patient's overall health, the age of the patient's own preferences. The main breast cancer treatment options may include surgery, radiation therapy, biological therapy, targeted drug therapy, hormone therapy, chemotherapy. Surgery. Surgery for breast cancer, lumpectomy, mastectomy, lymph node surgery, sentinel node biopsy, axillary lymph node dissection, breast reconstruction surgery. Lumpectomy. Breast conserving surgery, BCS, or partial, segmented mastectomy. Surgically removing the tumor and a small margin of healthy tissue around it. Followed by radiation therapy. Mastectomy. Surgically removing the breast and other infected components. Mastectomy includes simple mastectomy, modified radical mastectomy, a radical mastectomy. Simple mastectomy, removing the lobules, ducts, fatty tissue, nipple, areola, and some skin. Modified radical mastectomy, simple mastectomy combined with the removal of the axillary lymph nodes. Radical mastectomy, a simple mastectomy combined with removing the lymph nodes and muscles of the chest wall. Side effects of breast surgery: pain after the surgery and the change in the shape of the breast. Wound infection, buildup of blood and buildup of clear fluid in the wound. If axillary lymph nodes are removed, swelling of the arm and chest may occur, lymphedema. Lymph node surgery: axillary lymph node dissection, about 10 to 40 lymph nodes are removed. Usually done at the same time as the mastectomy or breast conserving surgery. Sentinel lymph node biopsy is used to determine if cancer has spread to the lymph nodes under the arm without removing many of them. A blue dye, radioactive substance is injected in order to identify the sentinel lymph nodes, which drains lymph from the tumor. They are then removed. Side effects of lymph node surgery: pain, swelling, bleeding, and infection. Swelling in the arm or chest, lymphedema. Lymphedema is mostly due to axillary lymph node biopsy. Reconstructive or breast implant surgery. Surgical procedures aimed at recreating a breast so that it looks as much as possible like the other breast. The surgeon may use a breast implant, or tissue from another part of the patient's body. Adjuvant and neoadjuvant therapy. Adjuvant therapy, after surgery. Combat metastasis. Chemotherapy and hormone therapy. Neoadjuvant therapy, before surgery. Reduce tumors. Radiation therapy. Radiation therapy for breast cancer. Radiation therapy is treatment with high-energy rays, such as X-rays, or particles to kill cancer cells. The patient may require 3 to 5 sessions per week for 3 to 6 weeks. The type of breast cancer will determine the type of radiation therapy used. Types of radiation therapy. Breast radiation therapy, applied after oral lumpectomy. Chest wall radiation therapy, applied after a mastectomy. Breast boost, a high dose of radiation therapy is applied to where the tumor was surgically removed. Lymph nodes radiation therapy, aimed at the axilla and surrounding area to destroy cancer cells that have reached the lymph nodes. Brachytherapy. Radiation to the breast by place radioactive seeds, pellets, into the breast tissue. The most common type brachytherapy used to treat breast cancer is called intracavitary brachytherapy. A device is put into the space left from breast-conserving surgery. A source of radiation is then placed in the device for a short time and then removed. Side effects of radiation therapy: swelling and heaviness in the breast. Sunburn-like changes in the skin and feeling very tired. Weakness. Damage some of the nerves to the arm. This can lead to numbness, pain, and weakness in the shoulder, arm and hand. Radiation to lymph nodes causes lymphedema. Chemotherapy. Chemotherapy, chemo, is the use of cancer-killing drugs. Intravenously, given as a shot, or taken as a pill or liquid. They enter the bloodstream and reach most parts of the body. Combats metastasis. Damage some normal cells. When is chemo administered? Before surgery, neoadjuvant chemo. After surgery, adjuvant chemo. How is chemo given? Doctors give chemo in cycles. The time between cycles is most often 2 or 3 weeks. For early-stage breast cancer, the total course of treatment usually lasts for 3 to 6 months. For advanced breast cancer, chemo is often continued as long as it is working. Side effects. The side effects of chemo depend on the type of drugs used, the amount given, and the length of treatment. Short-term side effects. Hair loss. Loss of appetite or increased appetite. Nausea and vomiting. A higher risk of infection, low WBC count. Stopping of menstrual periods. Easy bruising or bleeding, low platelets. Being very tired. Long-term side effects. Menstrual changes, infertility. Nerve damage, pain, burning or tingling and sensitivity to cold or hot. Heart damage. Hormone therapy for breast cancer. Used for breast cancers that are sensitive to hormones. These types of cancer are often referred to as ER-positive, estrogen receptor positive, and PR-positive, progesterone receptor positive, cancers. Estrogen and progesterone promotes cancer growth. Drugs used to block estrogen: tamoxifen, tamoxifen, Fariston, fulvestrant. Hormone therapy for breast cancer. Drugs used to change hormone levels: aromatase inhibitors, AIs, stop fat tissue from making estrogen after menopause. Luteinizing hormone releasing hormone, LHRH, analogs, shuts down the ovaries. Targeted therapy for breast cancer. Drugs that target HER2 protein that increase cancer growth. Trastuzumab, Herceptin, fortezumab, Perjeta, formotrastuzumab emtansine, Capsula, Lapatinib, Tigerb, pill. Side effects: mouth sores, diarrhea, nausea, fatigue, feeling weak or tired, low blood counts, shortness of breath, cough. Please like and subscribe my channel for latest videos by pressing subscribe button and bell icon.